Day 3 of the Minnesota nurses strike begins in just a couple of hours, but some nurses will be returning to their jobs before the strike officially ends tomorrow morning. Our Pauline Lee is live outside of United Hospital in St. Paul to explain why. And also new this morning, Pauline, you're hearing from patients on how they've been feeling throughout the strike.
Yeah, that's right. Let's start with the nurses here at United. Alina released in a statement that nurses at United, they'll be returning to the job at 6:30 tonight. Now, Minnesota Nurses Association says it's because of a clerical error in their 10-day strike notice, just impacting the United nurses. The rest of the Alina system nurses, as well as all the other strike nurses, they'll be returning to their jobs starting at 7 tomorrow. That's when the strike officially ends. Now to the patients. Obviously, the strike has been stressful, not just for the nurses and the hospital systems, but also for the patients. We caught up with Ryan Nelson Kane. He's from Brooklyn Center. He and his wife have a scheduled C-section for their first child here at United Hospital tomorrow morning. But before we knew that United nurses were returning to their jobs tonight, Ryan says they tried to reschedule their C-section after finding out that they'd be working with travel nurses. But they were not able to do so. That's because of hospital policy. They would have needed a medical reason to move the procedure. He says he has no problem with the care travel nurses can provide. But it's about showing their support for the striking nurses and their fight for better staffing and fair wages.
People are not going to stop getting sick. They're not going to stop having babies. They're not going to stop needing care. There's always going to be a market for the hospitals and for the companies that run them and the people that they partner with, the groups that they partner with to continue to make money. That's not always the case for labor. And they deserve a cut of the pie for the work that they're putting in for the hospitals to recoup that money.
Now, Alina and union nurses, they were actually supposed to meet yesterday to continue contract negotiations. That meeting was canceled. As we've reported in the past, Alina wants to wait until after the strike is over to continue negotiations. Still, though, no date set for when both sides will head back to the negotiating table.
Hopefully it'll come soon after tomorrow. Pauline, thank you. Now, we will let you know if a breakthrough deal does come together today. Stick with WCCO and our streaming station, CBS News Minnesota, for any updates.
Michael, 15,000 Minnesota nurses will head back to the picket line this morning for the last full day of their historic strike. It comes as Alina Health has announced nurses at United Hospital will return to their jobs tonight at 6:30. That's where we find our Pauline Lee this morning with a closer look at why. Pauline, good morning.
Good morning, AJ. Yeah, we reached out to the Minnesota Nurses Association. They say it's because of a clerical error found in their 10-day strike notice. That's only affecting the United Hospital nurses. All of the other Alina nurses and all of the other strike nurses, they'll return to their jobs starting at 7 tomorrow morning. That's when the strike officially ends. Still no dates on the books yet as to when both sides will head back to the table. But the early return for the United nurses, it's actually some good news for at least some patients. We caught up with Ryan Nelson Kane. He and his wife actually have a scheduled C-section here at United for their first child tomorrow morning. Now, before we knew that United nurses were returning to the jobs tonight, Ryan says they tried to reschedule their C-section after finding out that they'd be working with traveling nurses. But they weren't able to. That's because of hospital policy that they needed a medical reason to move the procedure. He says for him, it's about showing solidarity for the striking nurses. He says they've done their research. They had no problem with the quality of care travel nurses can provide, but they understand that that's not the case for everyone.
We have the ability and the resources to go ask the questions and the know-how to kind of navigate the situation. But for someone who just hears this and you're planning to have a child, you've got enough going on that you don't need the added stress of trying to worry about what your care is going to look like on the day that you're delivering your child.
And we also reached out to Alina for more information about these traveling nurses. Here's what they said in a statement. They said the replacement RNs are quality, experienced nurses. They are licensed by the Minnesota Board of Nursing, and they meet the same credentialing guidelines as our staffing nurses. They also went on to add that they've had successful visits throughout this week, and here is one of those traveling buses right now as the travel nurses begin their final day of work here during the strike. But as we mentioned, the Alina Hospital system also has had successful visits from the Minnesota Department of Health throughout the week. The department has been going through hospital to hospital, the ones that have been affected by this strike, just to make sure that quality care is still being delivered.
Yeah, Pauline, what we see 8 traveling nurses buses yesterday, so all eyes going to be on day 3 of the nurses strike today. We appreciate that update. Thank you. Stick with WCCO and our streaming station, CBS News Minnesota, for any updates once negotiations resume.